Thank you for joining me for today's live. It's it is very late, but I thought better late than never. So we'll be here for an hour and I will be discussing what I intended to do for this month, which is to discuss all matters to do with the hair, the scalp, and the skin. And so thank you for joining me. And today I wanted to address some things to do with the profession that I'm in and where certain professional skills lie. So my name is Djanie, and I currently work in a small studio in my home, and I fix people's hair. I care for their hair and scalp, and I also care for their skin. And so some of the things that come up are the reasons why I chose to do these lives. So welcome and join me if you're here. Don't forget to say hi in the chat so I can see you. I'm just quickly going to put a note out to let people know that I am live so that they can join me, because today is later than usual. So I'm fully aware that that could cause a bit of a problem. So let's just make a post. So I'm coming live tonight again for an hour. I'm not sure what I'll be discussing today because there's a lot on my mind. So don't forget to join me to learn all you need to learn about the hair. So I'm coming live tonight. Okay, so I've just shared my post. I hope people will be notified. But today I wanted to talk about something that kind of pinged my interest, and it was a discussion that I had with someone online, and it inspired today's live. Although this was not what I wanted to talk about, I thought it would be great to discuss this, and which is the subject matter is very simple, and it is your hair, scalp, and skin. So any hair, scalp, and skin issues you have, who can help you best? So we have several people within this area, within our industry, and most people struggle with finding out who to go to when they are in search of somebody to help them. So the post that I commented on, I shall read the comment that I made, and it was one that was thoughtfully crafted so that I can share this today. And I felt that it will contribute to today's discussion, and so I formulated it very well so that I can use it again. It's about being efficient with me within my work. So this was the comment, and it read, this is from me to a post that I had seen, and it said, "The truth is that not all trichologists actually care for hair. There is a huge space in this industry for expert hair care practitioners who specialize in certain hair types. And have trichological expertise and come from a hairdressing background. Those are the true experts. Trichologists do not need hairdressing or hair care experience as prerequisites to be able to study or practice trichology. Although sometimes that is helpful, it is not a prerequisite to study or practice trichology. Some trichologists are not adequately trained. And so the industry that we're in at the moment is not an industry that is regulated, unfortunately. And so you might find out that you might find out that how they trained I'm so sorry. One moment, please. So you might find out how they trained. You must find out how they trained. We are still trying to have trichology heavily regulated because we feel that the industry needs it. And hairdressers dress the hair practitioners care for the hair, and trichologists, among other things, some can only do what it says on the tin, which is to help with the pathologies of the hair and scalp. And then you must find the experienced ones amongst all of them, whilst identifying the ones who do continuous professional development. So I also mentioned that goodness knows that there are also hair coaches who have their hair as the only example that they can coach from. What I was trying to say is that it isn't easy within the field that we're in at the moment, especially for the client who's seeking for some help. It isn't easy at all because you must find a great hairdresser who is a hair care practitioner. Or you might find a hairdresser who isn't a hair care practitioner. You might find a trichologist who couldn't style your hair, for example, or perhaps detangle your hair. You might find a trichologist who does not offer treatments. So they may help you to identify and troubleshoot some of the ailments that you're going through, but they may not be able to offer you actual tangible treatments that they can administer to you so that you can follow that treatment at home. And I also mentioned that it is the service user's duty to find out the depth of the knowledge, the experience, the specialties, the service offerings, etc., for each professional. And one of the statements that I made that I feel that I want to really kind of base today's live on is the fact that the hair game is a complex one, and it leaves people exposed to exploitation. So there is this lure that grabs people's attention somehow about you know th- things to do with their hair and scalp and skin, and leaves them vulnerable to be exploited. And I wanted to basically address some of those things today. So within this field, especially the hair field to be precise, I'm going to start with that and then I'll go into the skin area. So with the hair, we have hairdressers, for example, who are able to dress the hair, and they style the hair in a way that makes the hair look beautiful. Some may just braid the hair, for example. Whatever you ask them to do, they will do for you. And they'll braid it in the style that you've asked for them to do it in. They may not cleanse the hair, they may not treat the hair, they may not be able to assess and evaluate the scalp area to see if it is a conducive area for the style that you have chosen to be installed, for example. They may not be able to analyze the hair itself to see if it's strong enough for the actual treatment the styling to go ahead. Their duty is solely to style the hair in the way that you have asked them to. And so if you go to a hairdresser and you're asking for something to do with hair care or scalp care, they may find that difficult to be able to assist you with. If you then visit, a hair care practitioner, for example, and that person is there to care for your hair, they may say to you, depending on the styles that you may choose to have, they may decide that they do not want to conduct that style for you because it will damage your hair. Okay. They may decide, I don't feel that, or they may say to you, I don't feel that this is the right thing for you because your hair is it's not healthy enough for us to do this, or you need to have certain treatments to make sure that the hair's well enough to carry on. But all in all, a hair care practitioner would be able to guide you to let you know whether certain hairstyles that you prefer or you're choosing to have can actually be done without further damage to your hair. And then we have hair coaches. Hair coaches sometimes come from a hairdressing background, sometimes they come from a hair care practitioner background, and sometimes they also come from trichological backgrounds. Sometimes we also find that there are hair coaches who don't have any of these expertise whatsoever, but they have managed to grow very long hair, and they sometimes attribute that to their ability to help hair grow, sans the advice that we always give clients, which is bespoke. So they only go by what they have done to help their hair grow, omitting the fact that we understand that there are intrinsic factors that actually determines a person's ability to retain long hair. So you'll find that they may omit that very important information, which is that if you inherently or intrinsically are not genetically in that space to have long hair, there is a chance that your hair will grow up to a certain point and may not exceed that range. That has to be discussed. Whenever I see clients, I discuss with them the potential that they have for hair growth based on the intrinsic factors, which are normally genetically factors that we have to address to make sure that their expectations are managed and that they don't feel that something is wrong with them just because they cannot, grow longer hair or retain the length of the hair that they grow. And then we have trichologists. Trichologists are trained to deal with the ailments and pathologies of the hair and scalp. Their job is to help you to troubleshoot scalp issues that you may be having and also hair shaft disorders that you may have. I have my notes here, so I'm going to refer to my notes so that I don't forget some things. Trichologists are skilled in the work that they do, in that it is trichology as a study provides a holistic approach for the practitioner to be able to help a client who is going through hair shaft disorders or scalp disorders. It's a broad spectrum of a profession that includes knowing about other people's work, so such as the GPs, dermatologists, and nutritionists as such, so that we become aware of what they do, what their jobs are. Therefore, we would know where to signpost you should you need any further assistance. So if you need any further help with the ailments that you're going through, we trichologists must find a way to be able to signpost you to the right person or the right professional. And so when somebody is going through hair care issues or hair loss issues, a trichologist's role is to find out what is essentially causing that issue. Could it be a nutritional issue? Could it be an environmental issue? So extrinsic factors. Could it be something that is happening to the client's or the patient's internal um, system? Is it happening internally and that it's revealing itself and exposing itself on the external in this way? Is it something that it's temporary? Is it chronic? Is it going to resolve itself naturally? Is it not? The trichologist's role is to allay those fears or any worries that the patient might have and help to diagnose what the cause of the hair loss issue is. So, just to recap, we have a hairdresser who may or may not be a trichologist, a haircare practitioner, again, who may or may not be a trichologist or a hairdresser. We have a hair coach who may or may not be a hairdresser, a trichologist, or a haircare practitioner. And then we have a trichologist who also may or may not be a hairdresser, a hair coach, or a haircare practitioner. And so I'm hoping that what I'm discussing today will help in that when you are going through something and you feel that things aren't working as they used to, that you know who to go to. My duty here is to make sure that, or to help people actually understand that this area, because of its complexity, that we may end up finding ourselves spending a lot of money and actually not getting to the help that we really need. I say this because there are hair loss conditions that spontaneously recover. We have hair loss conditions that are temporary. We have hair loss conditions that are permanent. And we have hair loss conditions that occur due to stressful situations that, if unmanaged, can trigger other permanent hair loss conditions. So it's incredibly important that we know where we need to go to get the right help that we need. If you find that your hair is just a little bit different to what it used to be, and you start by going to your hairdresser, for example, and ask for help there. If there is no help coming, or perhaps they don't feel that they can help you with the query that you have, you need to sort of know where you're going next after that. I haven't mentioned the topmost professions, which are your GP and your dermatologist. I've just kept it within this field because of the fact that I am fully aware, or rather, I have made sure that people are fully aware that the advice that I give here is not coming from a place of as a medical profession. It is not a consultation for you. This is not what I am doing. I am not your GP. And so anything that you have that is of concern to you, you must visit your doctor to seek advice from there first. I am talking really about the adjunct care that we give to clients who may have seen a GP before or choose to go privately to see these professional people, such as hair coaches, hair care practitioners, and trichologists. And so, my advice really is always to ensure that you do your due diligence. When you're going to see someone for something, whether it is hairdressing or trichological help, it's important that you do your due diligence and make sure that you are researching the person that you're going to see. As much as people expect trichologists to be able to conduct treatments and give them advice, I'm afraid it's a space that we also must be careful in when we're entering into that space. There are people who are working with the title, who may not have gained adequate training, prior training, that warrants them the title to operate in that manner. So, for example, if you go to see a hairdresser, there are certain things you need to look out for, how things are happening, because the way they operate will indicate whether your experience with the hairdresser may not leave you with other issues that occurred as a result of the treatment you've just had. You may see a hairdresser and you may have just a style and may end up with other concerns later on in the day, later on, as a cause of the treatment that you've had. So it is important that we do our due diligence to make sure that the hairdresser is qualified to conduct those treatments for you, and that they are practicing in a professional manner to prevent things from happening to you, such as injuries, for example, burns, scalp burns, for example, chemical burns, or accidents, or infestation or infections that you may be exposed to if they're not doing what they need to do to make sure that their clients are safe. Likewise, if you go to see a hair coach, it would be the same sort of standard that I would expect that you should be doing your research on, just to make sure that that is happening for you. And then if you see a trichologist, it would be the same also. So we are bound by things that we do at every stage of this profession. And these guidelines are there to protect you as a patient, as a client, or as a customer, a service user. This is just there for you, to help you, so that we can practice safely and that you will be safe when you come in to receive the treatments that you desire. I want to continue by talking about accepting professional limitations within this industry. I may have touched on it earlier, but I just want to talk about it briefly. That we need to know, as professionals within this industry, where our limitations end. It is important that the client, or the patient, or the service user who comes in feels confident that when it gets to a point and the person that you've asked for help from, or you're seeking their help from, can say that this is where my limitations are, and that from here on someone else needs to help you. So as a hairdresser, hairdressing stops with dressing the hair. As a hair care practitioner, that also stops with caring for the hair. And then the trichologist is the one that will lead you into helping you with scalp ailments and hair shaft disorders. Likewise, the trichologist also needs to know where their professional limitations lie and know when to also signpost you to get the right help for what you're going through. I want to talk about, sorry, I forgot to say, if there's somebody in the chat that's saying hello, you can just comment and say hello. If anything I'm saying makes sense to you, or you're learning something new, please make sure you comment and let me know. If you have any questions at all that you want answering for the next live, this would be a great opportunity for you to ask that question so that I can answer that tomorrow or another day. Okay. I want to talk about trichologists and the skills that they need to have. I have spoken about hairdressing at length. I think that we all know what hairdressers do. And I've spoken about hair coaches and also hair care practitioners. So we've got some idea of that. But with trichologists, we must know how carefully trained that they are, and how confident with the work that they do for you, how confident they are with the work that they do for you. They need to have received, as I've said before, adequate training, adequate level of training. This includes both theory and clinical observation by an approved institution. They need to have great consultation and interviewing skills. They need to be observant, and they also have to be sympathetic in the way that they deal with you as a patient, and also be supportive with you on your journey to recovery. Communication skills is also important in this area because of the fact that it is through that we can actually get the information that we need to be able to help you properly. And so communication skills is fundamental. Okay. Once you have seen once you've seen a trichologist, it is good to build a relationship between your trichologist and your hairdresser, especially if your trichologist does not dress hair. And so, if you can imagine, after you've seen a trichologist, there is a high chance that you're going to go on to have your hair dressed by somebody else, especially if, as I said before, the trichologist does not dress the hair, then you'll need to go elsewhere to get that service. So, building these relationships between a trichologist, your hairdresser, and uh, um, your medical professional is very important. Having that relationship is so important between the providers, the professional people in your life who are helping you on your journey. So, some treatments that trichologists may offer can be contagious and it can be infectious. And so we need to make sure that you have seen a GP before you come in, or you have seen somebody such as a dermatologist, for example, before you come in. If you haven't, there may be a chance that you may be signposted back to to the dermatologist or the GP, and that is normal. Okay, so I want to stop there with this level of education on what happens when you go and see somebody when you have got hair and scalp issues. And then I want to start to talk about the skin itself. With the skin, we have people who deal on different levels with your skin care issues. So we have beauticians who are beauty therapists, and then we have advanced beauticians, and then we have aesthetic practitioners. Some dermatologists also carry out some treatments to do with the skin as well. So it falls in the same sort of levels as I mentioned before with the hair and scalp. If you're wanting relaxation, you want to be pampered, you want to get that feel good factor in a treatment that perhaps does not break the acid mantle or does not go deeper into the layers of your skin, you would consult the help of a beautician, for example. So they will cleanse, they will tone, they will exfoliate your skin. There are treatments that they do that has great benefits too. They just have limitations as to what service they can provide. When you see an advanced skin therapist, they may be able to start introducing things such as um, high frequency treatments, for example. So the electrical treatments that really start to look at problematic skin issues such as fine lines, wrinkles, rosacea, acne, pigmentation issues, both hyper and hypopigmentation problems, um, things like collagen loss, so on and so forth. And then you would see a dermatologist for the invasive treatments that really kind of shift your treatments forward and get you to a speedier recovery, or that the skin condition that you're having is inflamed, and so you need expert treatment or medical graded treatments. So that is what the dermatologist will be looking to do for you. So beauty therapists give your first, if you have no problems whatsoever, but you want to start to build some kind of regime within your system of caring for your skin, you want to perhaps start introducing new things that you want to see the effects of. You started maybe looking after yourself a little bit more and you're wanting to explore what the possibilities are. You would go and see a beauty therapist when you don't have any sort of issues with your skin and you're just wanting to, give that edge to the treatments that you're giving yourself at home, for example, or you want a little bit of a boost in your mood, you go and see a beauty therapist. And that is fine. There is nothing wrong with that. We could have aesthetic practitioners or advanced skincare practitioners who also do that for you. But when you're looking for something that is a little bit more than what a beauty therapist would give you, so you may have a wedding coming up, it may be a case of you have noticed that there are slight concerns that are coming in, your skin is breaking out a little bit more than usual. You've reached a certain stage in your life where things are starting to show up a little bit more. So, things such as lines and wrinkles and things are showing up a bit more, and you're wanting to perhaps start to prevent those things from happening, or you want to slow things down a little bit, you would go and see an advanced skincare practitioner. And then if you want that complementary treatment that really supports your day-to-day skincare, things like injectables, fillers, and things like that, you would see a dermatologist for that, and they'll be able to administer that for you. So, beauty therapists and advanced skincare practitioners generally do not enter the dermis of the skin. We stay really around the epidermis. It is when they have had some medical background and they have trained in other areas that they then start to do the injectables and things like that, for example. Okay, so you could have microneedling, for example, done by an advanced therapist, but you may not be able to have fillers and injectables done for you by an advanced therapist. This is just to let you know who to go to for the best results that you're looking for, so that you can get the best for your money. I'm here to help in the delivery of the education that I give you, because I get clients who come in most of the time unaware of what each professional body is supposed to do for them. They mostly don't understand what people do, and then they get disappointed when they don't get what the outcome that they are looking for. And so I find that this is all because the understanding of what each professional does is very vague. So this video is to help with that so that people can be aware of what to look for when they're ready to go and get the help that they need. I can't think of anything else to discuss apart from the fact that anything that you do within your body intrinsically has a great effect on both your skin and your hair. And so when you're looking after yourself holistically, it does have its benefits altogether. So we generally advise that people should look after themselves well enough from the inside out so that the goodness that you're putting inside of your body can reach the extremities of the rest of your body. So that will be your hair, your scalp, and your skin. The only way for us to actually get that good quality skin, good quality hair, and to have that scalp area conducive to grow great hair is to ensure that we are feeding our bodies enough nutrients that the rest can actually come out towards the extremes to help with the outer areas of our bodies. So things such as eating well, eating enough fats, making sure that your levels are adequate. I'm not talking about enough ferritin levels or hemoglobin or whatever to help you stay alive. I'm talking about enough to help you stay alive and well. Okay, so not just for you to be alive, but enough for you to be alive and well. And that is when our skin, hair, and scalp flourishes because we've given our bodies so much, because your body naturally takes away the best part of what you put inside of your body. If there's anything left, that is when that goes over to your scalp, your skin, and your hair. So if you're not giving it enough, you cannot expect that you will have good quality hair and great skin if you're not looking after yourself inside out. You just must give yourself the best you can so that the rest can come out and feed the external parts of your body, which is your scalp, your skin, and your hair. And on that note, I shall end the live today, unless there is anything else that anybody else wants to ask. There is nothing else that I need to talk about, but in the future lives, I should be discussing things like the treatments that you should be expecting to get from trichologists, from skin therapists, from hair care practitioners. I will be talking about things to do with the hair itself as a structure, the cuticle layers, treatments and things that help with certain pathologies of the hair and scalp and skin. I will be talking about how to treat your hair yourself at home. I'll be talking about playing the kitchen chemist or the kitchen hairdresser and how that may affect the outcome of your hair and the success of your hair growth journey. I will be talking about things that you should look out for to help you start to not self-diagnose, but become self-aware of scalp conditions that may contribute to hair loss in the long run. Because as you can imagine, it's really difficult. We never know what is actually going on in our scalps. Nobody really sits and analyzes their scalp as well as we may see and analyze our skin and so on and so forth. And so it's a blind spot for us. And it's really important that we understand that every so often it is important to go and get scalp health analysis done, just so that you can, be aware of anything that may be happening. As I've always advised in the past, the sooner you deal with scalp situations, the better it is, because scalp problems And hair loss issues are progressive. If you don't treat them as they happen, unfortunately, they progress to become really the bane of your life, I'm afraid. So, the important thing is to make sure that you are proactive in what you do. You get scalp analysis when you can. Make it a thing that you do to act as a preventative measure in case something is going on and you feel like you just need someone to look at. And also, it helps in the sense that when there's a change on in your scalp or in your hair, you would know when it started. You would be able to, go backwards in cataloging when things occurred. It helps to also diagnose you should there be an issue at a later date, so that the diagnosis doesn't take too long, and that you can have the help that you actually need. So, as a preventative rule, I say to people, my tagline is always, how do you make sure you don't need to see a trichologist? And the answer to that is, see a trichologist. So, as little as you can is better than not doing so at all. But every so often, if you go in and see someone to just have a delve into your scalp and into your hair, just to make sure, even if you're doing things at home for yourself and you're treating your hair at home and you find that things are working really well for you, it is good to every so often just have a little scalp health check and hair health check, just to make sure that everything's doing well, everything's going well, and that you are on the right track. Because usually, when things start going wrong with our hair and scalp, it is because something has started developing itself within our bodies prior, maybe 6 months prior or so. And so it reveals itself 6 months later. Anything that is occurring within your body that is causing you to feel not your best self will transpire itself to your hair by depleting the quality of the hair, and also showing itself signs on the scalp in depletion of scalp health, as a way of almost saying, 6 months ago or so, you were really unwell, and now I've had to rescue you. Your body saying that to you, that 6 months ago you were really unwell, and I've had to rescue you by taking care of your organs. So, unfortunately, I have not given any food or any nutrients to your hair and scalp because I've had to keep you alive. So, it's an indicator of what has happened months prior. Any scalp health or issues that you go through, majority of the time, it is an indicator of an issue that occurred 6 months to 12 months prior. So, health checks are really important. Hair health, scalp health, skin health checks are really important. We must look after ourselves holistically, and so that we can be the best and we can be living, not just living, but living well. On that note, thank you and good night.